So I have gotten an order for a patient and I'm going to get his medications. I see that he currently has a fever and he was given acetaminophen at 1:30 this morning. His temperature is 102.5, so he's allowed to have acetaminophen every 4 hours as needed. It's 8 o'clock right now, so I can give him acetaminophen. I see that his blood glucose is 215. Doctor says to give him 5 units of regular insulin for that range. So I gave him 5 units of regular insulin and Tylenol as well. So I'm gonna get my gloves on. We are getting all of our 8 o'clock meds right now. Alright, I'm going to get Coumadin, check the expiration date. We are good. Tensin, checking the expiration date. We're good. And acetaminophen. He is prescribed 650 milligrams. These are 325, so I'm going to give him 2 pills. Alright, so I'm going to get the insulin. And I'm going to get he's getting 10 units of NPH and 5 units of regular. Alcohol swab, and the dates on these are not expired, they're good. So we get an alcohol swab, and I'm going to rub this one. And then on a different part, I'm going to rub this one. And since I'm giving 15 units, I'm going to draw 15 units out of here, put 15 units of air in here. And I'm going to put 5 units of air in the NPH first, the cloudy. Then I'm going to put 10 units of air in the regular insulin, the clear. And I'm going to grab my 5 units that the doctor prescribed. More units. Alright, make sure there's no air in there. Use the scoop method. Alright, so I'm going to recheck my meds against my bar. I've got my acetaminophen. I've got my low tensin, got my Coumadin, my insulin, insulin, and now I'm going to grab my IVs. And he's getting natural saline at 75 milliliters an hour, so I'm going to grab this. And then Americanum, and he's getting that at, he's getting 500 milligrams, so. Okay, 500 milligrams here, and the expiration is good. So, we're good there. Alright. Going to grab, generally these would not be open, but they are right now, so we're working with what we got here. Garbage. We're gonna make a load. And now I'm going to go to the patient's room. Since I've double checked everything with the bar, I have to put my insulin back. So I'm walking into the patient's room. I've introduced myself. Well, asked if I can come in and introduce myself. And I'm going to walk to the patient. I'm going to get my 2 patient identifiers, ask for any allergies, because they're getting a lot of meds right now. Oh, man. So I'm going to boom. There's some gloves on. And I'm actually going to run back to the bedroom because I forgot my IV flush. So, now I'm back. Alright, now I'm going to foam again. Oh, and I would raise this bed, but for some reason the power is not working in here right now. Or the bed's broke. So, we're going to have to work at a low level right now. So, I'm going to go ahead and get this IV set. If this was new, I would have just been able to stick that in there. So, I just don't have a new one right now. Alright, and then you fill this halfway up. Oh. Alright, now I'm going to bleed all the air out of the line. Generally there would not be this much air, but this line's been used already. Alright. I dropped my a red cap, which you should not do. So I'm gonna have to wipe that down in a minute. Just diagnose for 500 milligrams of meropenem. So I'm going to piggyback this in just a moment. Once I get everything going. Alright. Go ahead and flush his line. I should have brought alcohol swabs with me. I'm learning to fill my pockets. Alright. So, flush his line, make sure it's patent. 5 on the side, 5 up top. It. Oh, gotta get your air bubble out. Alright, now we're good. Don't want to make him any more comfortable than he already is. Alright. So, it is patent and flushed. IV going. Alright, I'm going to come back. Different side. Gotta get that. 5 on top. 5 around. Connect 2. Confirm. New patient, yes. Med surge, yes. Channel A. So that's where I'm connected. It's going to be a basic infusion. Need to bring the MA tomorrow with me. He needed 75 milliliters an hour. So we're going to type in a rate of 75 milliliters an hour. The bag is 500 milliliters, so I'm going to go ahead and put 400 so the alarm goes off before we run dry. Just start it. Open everything up. And we're dripping, so we're good. For the meropenem, I am going to have to, I'm going to piggyback this. And again, with new stuff, that would be fine to just connect. But slimes are all we got right now. Piggyback that, flush this and actually bring the fluid down. for the meropenem, it's not in this system, so I'm going to have to go back to channel A and actually change the rate of the primary, and I'm going to put 100 milliliters an hour. Generally I would go into secondary, but I can't because they don't have that medication here. And then volume of the bag, I'm going to put 50 here, because we can drain all that out and it's going to just take off the sodium. Alright, so that is set. Let's make sure. Oh, gotta press start. We're good. She's dripping. Alright, so I'm going to bring the meds to the patient. I've already checked to see if he's got any allergies. I'm going to explain everything. I've got the acetaminophen for your fever, the Lotensin for blood pressure, and the Coumadin is an anticoagulant. I'm going to ask the patient if they need any help with these or if they can open them on their own. If there's anything affecting their ability to take the pills and if they have any questions about them. I've got your insulin. Your glucose was a little high this morning, so I've got your regular insulin along with your regular NPH that we give you. Ask if they've got any questions about this, and with this you can find a fatty area. Some people go behind the arm. We're going to go in the abdomen right now. Pretend this is the abdomen. So we are going to have more alcohol swabs. We can go through a lot of these. More alcohol swabs. And I'm going to clean the area from inside out. It's a little sticky, it would generally go a little more fluent. And for the abdomen, just kind of hold to the side and just go straight in. Inject slowly. Do your one scoop. Then I'm going to dispose of this in the sharps container. Oh, okay. There's 2 sharps containers in this room. With the classmates. Alright, so I've given everything. I'm going to ask the patient if they have any further questions. The bed that I would have raised, I'm going to lower now. And then I'm going to just go out and leave.